What if the fatigue you wake up with every morning, the joint stiffness that greets you before your feet hit the floor, the bloating that appears without warning, and the foggy thinking that makes you feel 10 years older than you are? What if none of that is just aging? What if there is a specific, identifiable process happening inside your gut right now, today, that is driving all of it, silently, without a single dramatic warning sign? And what if a habit you have been following your entire life, one that feels completely harmless, is the very thing making it worse? Before you dismiss this, I need you to stay with me, because the science behind what I'm about to share is not guesswork. It comes from more than a decade of clinical and laboratory research into one of the most important drivers of aging-related disease. And most people over 60 have never been told about it. Before you accept another decade of these symptoms as inevitable, you need to know what I'm going to tell you today. My name is Dr. Sarah Envem. I have spent 16 years in internal medicine and preventive health, working almost exclusively with adults over 60. And I want to tell you about the observation that changed the way I practice. About 8 years ago, I began noticing a pattern I could not ignore. Patients arriving with entirely different diagnoses: high blood pressure, persistent joint pain, fatigue that sleep would not touch, recurring digestive trouble, worsening memory. Had one thing in common: that nobody was connecting. Their gut health was severely compromised. And in almost every case, a specific daily habit was quietly driving it. This video contains no products, no affiliate links, and no agenda. What I share today is grounded in published, peer-reviewed research. Where the evidence is strong, I will tell you so plainly. Where it is promising but still developing, I will say that too. What I want to give you today is the conversation your doctor may not have had time to have with you in a 15-minute appointment. Here is what is happening in your body right now that most people have never been told to connect to this topic. Your gut is home to approximately 38 trillion microorganisms, bacteria, fungi, and other microbes that collectively form what scientists call the gut microbiome. This is not a passive system. It trains your immune system, produces neurotransmitters including a significant portion of your body's serotonin, regulates inflammation throughout your entire body, and communicates directly with your brain through the vagus nerve. Research published in Nature Reviews Immunology has established clearly that the gut microbiome is one of the primary regulators of systemic immune activity. It is not a digestive accessory, it is a central organ of your health. Now, here's where age becomes the critical factor. First, microbial diversity. Research consistently shows that the number and variety of different bacterial species in the gut declines significantly after the age of 60. This has been documented in large-scale microbiome studies, including analysis published in Cell Host and Microbe. The lower diversity is directly associated with higher levels of circulating inflammatory markers, including interleukin-6 and C-reactive protein, the same biomarkers that predict cardiovascular disease, cognitive decline, and metabolic dysfunction. Second, intestinal permeability. The lining of your gut is a single layer of cells held together by proteins called tight junctions. After 60, the integrity of these tight junctions weakens. When they are compromised, fragments of bacterial endotoxins, specifically a compound called lipopolysaccharide, or LPS, can pass through the gut wall into your bloodstream. Your immune system recognizes LPS as foreign and mounts a response. Done occasionally, your body manages this without consequence. Done daily, over years. This creates what researchers now call low-grade chronic systemic inflammation, a persistent state of quiet immune activation that has been linked in published research in the journal Gut to cardiovascular disease, type 2 diabetes, arthritis, depression, and cognitive decline. Third, declining short-chain fatty acid production. Beneficial gut bacteria produce compounds called short-chain fatty acids, butyrate in particular, which nourish the cells lining your gut and actively suppress inflammatory signaling. When beneficial bacteria decline, butyrate production falls. The gut wall weakens further. The inflammatory cycle deepens. I want to pause here. If you experience persistent bloating, Joint stiffness in the first hour of the morning, fatigue that 8 hours of sleep does not resolve, or brain fog that comes and goes without clear cause? Type yes in the comments right now, because these are not random symptoms of getting older. They are the downstream signs of a gut under sustained biological stress. And they are telling you something that deserves a real answer. What accumulates silently over years of unaddressed gut inflammation is not trivial. Research published in the journals of gerontology has associated chronic low-grade inflammation with accelerated biological aging, meaning your cells are aging faster than your calendar age. This shows up in measurable biomarkers, and it is directly connected to the habits I am about to show you. Harold is 69, a retired civil engineer from Texas. He came to see me complaining of fatigue so persistent and unexplained that he had begun to wonder whether something serious was being missed. He had been thoroughly evaluated, thyroid panel, blood count, full cardiac workup, everything within normal range. 2 separate doctors had told him that fatigue at 69 was simply to be expected. When I asked Harold to walk me through a typical week of eating, he described something I encounter constantly in this age group. Breakfast was toast or boxed cereal. Lunch was usually a deli sandwich on white bread. Dinner was whatever was easiest. Frozen meals 3 or 4 nights a week. He took ibuprofen regularly for chronic knee pain. He had not eaten yogurt or any fermented food in years. Dietary fiber was minimal. And I asked Harold one question that nobody else had asked. How many courses of antibiotics had he taken in the past 4 years? He thought for a moment. 3. All for recurring sinus infections. Each prescription entirely appropriate. But each one had significantly disrupted his gut microbiome, and the recovery had never been supported. I recommended a specific gut restoration protocol. 4 weeks later, Harold's energy had meaningfully improved. His morning joint stiffness had reduced. His digestion, which he had stopped mentioning because he had simply normalized the discomfort, was noticeably better. He said, "I thought tired was just who I was now. I did not realize I was feeding the inflammation every single day." This was not a miracle. This was Harold's body responding to better conditions. Conditions he had simply never been given the information to create. Before I tell you what to do, I want to show you exactly what is working against your gut and your inflammatory levels every day. Understanding the mechanism is what makes the solution stick. Ultra-processed foods, packaged breads, boxed cereals, crackers, frozen meals, processed meats contain emulsifiers, preservatives, and chemical additives that research published in the journal Cell has shown directly alter gut microbial composition. Studies have found that common emulsifiers, including carboxymethylcellulose and polysorbate 80, thin the protective mucus layer lining the gut and actively promote intestinal permeability. This is not a fringe finding. It has been replicated across multiple human and animal studies. Every day that ultra-processed food makes up the majority of what you eat, you are feeding the inflammatory bacteria and starving the beneficial ones. Ibuprofen, naproxen, and daily aspirin are among the most commonly used medications in adults over 60, typically for chronic joint or back pain. They are effective for that purpose. But research published in Gut has documented that regular NSAID use increases intestinal permeability and directly damages the mucosal lining of the small intestine. Many people have been taking these medications daily for years, without any awareness of what they are doing to the gut structure that protects them from chronic inflammation. Physical activity is one of the most powerful drivers of gut microbial diversity. New research published in Gut Microbes has found that regular exercise significantly increases the abundance of butyrate-producing bacteria. Sitting for most of the day and sitting immediately after meals slows gut motility, reduces microbial diversity, and creates the conditions in which inflammatory bacteria thrive. I know what some of you are thinking. I have eaten this way my whole life. If it was really causing a problem, wouldn't I already know? Here is why you may not. Gut inflammation does not announce itself with a dramatic event. It accumulates slowly, quietly raising inflammatory markers, eroding microbial diversity, weakening the gut lining, until the downstream symptoms emerge and get filed away as aging, The damage is silent and cumulative. And that is precisely what makes it possible to miss for decades. But it is also what makes it reversible, because the gut microbiome responds to change within days to weeks, not years, days to weeks. The solution is a specific gut restoration protocol built around 4 elements: prebiotic fiber, fermented food, the elimination of one specific daily driver, and a 10-minute post-meal practice. These are not vague lifestyle suggestions. Each one has a documented physiological mechanism. Here is the biology. Your beneficial gut bacteria, the lactobacillus and bifidobacterium families in particular, feed primarily on prebiotic fiber, the indigestible plant material found in foods like garlic, onions, oats, leeks, and legumes. When you feed them consistently, they produce butyrate. Butyrate activates receptors on immune cells in the gut wall that directly signal them to reduce inflammatory activity. This is not a secondary or indirect effect. It is a primary immune regulatory mechanism documented in immunology research published in Nature. Fermented foods, live culture yogurt, kefir, sauerkraut, kimchi, introduce active bacterial cultures and their metabolites directly into your gut environment. Research published in Cell in 2021 from the Stanford Human Food Project found that a high fermented food diet significantly increased microbiome diversity and measurably reduced markers of immune activation in human participants. That is direct, replicated human evidence. The research supporting this protocol is not preliminary or experimental. It is the foundation of what gastroenterologists and clinical nutrition researchers now call microbiome-targeted dietary therapy. It is documented in peer-reviewed literature and endorsed in clinical nutrition guidelines. But this is only the first layer. What I am about to show you next multiplies every benefit I just described, and it costs nothing extra. Eleanor is 73, a retired school principal from Georgia. She had been managing confirmed low-grade gut inflammation for 3 years, documented on 2 successive gastroscopy evaluations. Her gastroenterologist had recommended medication to reduce the inflammatory activity. Eleanor had started it, and it was helping. But she lived with a private fear she had never quite put into words, even to her own doctor. Every night, somewhere between 2 and 3 in the morning, she lay awake doing a quiet internal inventory of her symptoms. She had not told her daughter how worried she genuinely was. She had started declining dinner invitations because she could not predict how her gut would behave away from home. Her husband had moved to a gentler sleeping schedule to accommodate her restlessness, and she felt quietly guilty about it. The medication was managing the problem, but Eleanor was not managing her fear of it. When she came to see me, I explained the mechanism in plain terms, how her current diet and sedentary evenings were actively working against the medication's ability to do its job. I recommended the gut restoration protocol alongside her existing treatment, not as a replacement. Over 8 weeks, her gastroenterologist noted a measurable reduction in inflammatory markers at her follow-up. Her nighttime awakenings decreased. She started accepting dinner invitations again, and she told me, "I stopped being afraid of my own body. I did not know I could actually be part of fixing this." That is the most important sentence in this entire video. Here is the complete numbered protocol. Every element has a mechanism. I want you to understand not just what to do, but why? Because that is what makes you keep doing it. 1 daily serving of prebiotic-rich food, half a cup of cooked oats, 1 garlic clove cooked into your meal, half a cup of lentils or chickpeas or a small leek, consistently feeds your butyrate-producing bacteria. The operative word is consistently. A single serving does little. A daily serving, sustained over 2 to 4 weeks, measurably shifts which bacteria dominate your gut environment. If you skip this step, you are feeding beneficial bacteria on some days and starving them on others. They do not accumulate benefit. You have to deliver it every day. 1 serving of live culture yogurt, kefir, or a small portion of refrigerated sauerkraut or kimchi introduces active bacterial cultures and their byproducts directly into your gut. Choose products labeled live and active cultures. Shelf-stable pasteurized sauerkraut contains no live cultures. It must be refrigerated and unpasteurized. If you skip fermented food, microbial diversity rebuilds more slowly. The protocol functions without it, but it functions measurably faster with it. You do not need to overhaul your entire diet at once. Identify the one ultra-processed food you consume most frequently, the daily breakfast cereal, the packaged crackers, the frozen entree 4 nights a week, and replace it with a whole food equivalent. One sustained substitution shifts your daily bacterial input significantly. Post-meal walking accelerates gut motility, reduces the post-meal blood glucose spike, and, based on research in gut microbes, directly increases the relative abundance of butyrate-producing species. 10 minutes is sufficient. It does not need to be vigorous. It needs to be consistent. I want to tell you about Raymond, 71, a retired accountant from North Carolina. Raymond followed the first 3 steps of the protocol but skipped the post-meal walk because of a knee problem. After 3 weeks, his energy had modestly improved, but his bloating and morning stiffness remained. When I asked specifically about post-meal movement, he confirmed he had been sitting immediately after every meal. I worked with him on a simple seated alternative: slow foot circles, my knee lifts, standing and sitting 10 times, which partially replicated the motility effect. 2 weeks later, his bloating had meaningfully improved. He said, "I had no idea sitting down to rest after dinner was the very thing slowing everything down." The correction was simple. The relief came quickly. The total investment for this protocol is a modest shift in your weekly grocery list, potentially no additional cost at all, and 10 minutes of movement after dinner. That is the full commitment. Adding large amounts of fermented food and prebiotic fiber at the same time in the first week. If your microbiome has been depleted for years, a sudden influx of prebiotic fiber produces significant bloating and gas as bacteria rapidly multiply. Start with a small portion, a tablespoon of sauerkraut, on a 1/4 cup of oats, and increase slowly over 2 weeks. People who experience discomfort and abandon the protocol in week 1 are almost always people who move too fast. Substituting probiotic supplements for fermented food and expecting the same result. Probiotic supplements vary widely in strain quality, survivability through stomach acid, and dosing reliability. Research on food-based probiotics consistently demonstrates stronger and more durable microbiome effects than most commercially available capsule supplements. Supplements are not without value, but they are not a substitute for the protocol. If you spend money on a capsule and skip the fermented food, you are likely spending more for a lesser outcome. Trying to implement every element of this protocol simultaneously after years of established eating habits. In your grocery routine, your cooking patterns, and your post-meal behavior are deeply grooved. Introducing 4 simultaneous changes in 1 week overwhelms the decision-making system, and one difficult or busy day collapses the whole structure. Introduce 1 element every 2 to 3 days. Within 2 weeks, everything feels entirely natural, and you are receiving the full benefit of the complete protocol. Tonight, 1 thing only. With your evening meal, add something with live cultures. A serving of live culture yogurt alongside dinner. A small glass of kefir. That is the entire ask for tonight. 1 habit, 1 meal, add 1 prebiotic food to your daily routine. Cooked oats at breakfast, lentils at lunch, garlic in your dinner. The additional grocery cost is between $2 and $4 per week. And begin a 10-minute walk after your largest meal of the day. You do not need equipment, you need consistency. The complete protocol, every day. 1 prebiotic food, 1 fermented food, 1 ultra-processed food replaced with a whole food equivalent, and 10 minutes of post-meal movement. The 30-day challenge, each morning, track 3 specific things: your energy level on waking, your digestive comfort during the day, and your joint stiffness in the first 30 minutes. Come back to the comments in 30 days and tell me what changed. I will read every single one. I want to say something to you directly before you go. You are not broken. Some of what you have accepted as the inevitable cost of getting older is nutritional. And nutritional problems have nutritional solutions. I am not telling you that changing what you eat will cure inflammatory disease, eliminate your need for prescribed medication, or undo decades of damage overnight. I would never overstate what the evidence supports. And I have been careful throughout this video to tell you honestly where the research is strong and where it is still developing. What I am telling you is this: your gut microbiome is one of the most responsive and adaptable systems in your entire body. It begins to shift within 24 to 48 hours of dietary change. The microbial diversity that supports your immune system, your brain chemistry, your joint health, and your energy levels is not permanently fixed by your age. It is not locked in by your genetics. It responds genuinely and measurably to what you give it. And the information I have shared today requires no prescription, no specialist referral, and no significant financial investment. It requires only that someone take the time to explain it clearly and that you decide it is worth trying. If this video gave you something honest and useful, something your doctor may not have had time to explain, I have one request. Think of one person in your life, not everyone you know. One person who deals with persistent fatigue, joint pain, bloating, or a quiet sense that their body is working against them. One click puts this information in front of them. One person. If you are new here, subscribe. Every week I bring you evidence-based health information designed specifically for adults over 60, practical, honest, and grounded in what the research actually shows, not what is designed to alarm you. Now, before you leave, drop one comment. Which single change from today's video are you going to make first? I read every comment personally because everyone watching this matters to me, not as a viewer, as a patient. Your body has not given up on you. Give it the conditions it needs to do that work well. Close-up of fermented foods, yogurt, kimchi, sauerkraut on a kitchen counter, senior walking outside after a meal in a park or garden setting, gut anatomy animation showing bacterial diversity and the gut lining, grocery store scene, whole foods versus processed foods contrast, senior reading a nutrition label, doctor reviewing patient notes at a desk in warm, natural light. Highlight key terms during the science section: gut microbiome, intestinal permeability, butyrate, short-chain fatty acids, ILPS/lipopolysaccharide, with brief definitions displayed on screen. Show the 4 protocol steps as a numbered graphic overlay during Section 8. Display type yes in the comments as text on screen during the symptom call-out in Section 3. Split image, left side shows a gut anatomy graphic with red inflammation visual, right side shows Dr. Envem pointing at camera with a direct, concerned expression. Bold white text overlay, this is quietly destroying your gut after 60. Subtext, most doctors don't have time to explain this.